Hello there. My name is Zila Langshan. I'm the founder of HiQuity Solutions. This is another a strategic funding breakdown of an opportunity that was released this last Friday, I believe the 6th, at the end of the business day. It's one of three that SAMHSA dropped. This is the fiscal year 2026 Implementing Zero Suicide in Health Systems. Keywords, health systems. So in one sentence, this is a structured SAMHSA health system transformation opportunity that is for applicants who are ready to implement all 7 areas of the Zero Suicide as an organization-wide operating model under active federal oversight. Let's break that down a bit. This is a cooperative agreement, 31 anticipated awards, up to $16.11 million anticipated in total funding, with a 2-tiered funding system based on applicant type. So $700,000 a year for states and U.S. territories, and then up to $400,000 a year for tribes, tribal organizations, community-based primary care, behavioral health organizations, emergency departments, and public health agencies. Project period is 5 years. Applications are due by April 20th of 2026. That's coming soon. We've got right now, as of today, 5 weeks and some change. The awards timeline is slated for September of 2026. In this interim period between now and then, we've got a review period during which evaluators will be heavily focusing on implementation design, treatment choices, and then also the overall performance management readiness. Because this is a cooperative agreement, you can expect very active federal oversight for the up to 5-year project window. This includes mandatory budgeted travel for years 2 and 4. This funding is not a narrow pilot. It's not a light touch training grant. It is a whole system implementation of the Zero Suicide Framework. So SAMHSA is going to expect the funds to support active leadership oversight, workforce training for both clinical and non-clinical staff, and the establishment of universal screening and assessment planning. You must also deliver specific named evidence-based treatments, operationalize your transition of care protocols, and then maintain a robust and continuous quality improvement strategy. Eligibility is strictly defined. It is limited to specific health system and public sector entities, among them community-based primary care, behavioral health care settings, hospital emergency departments, state mental health agencies, public health agencies, U.S. territories, and Indian tribes or tribal organizations. It's worth noting, SAMHSA plans to reserve at least 2 awards specifically for tribes or tribal organizations, assuming, of course, a sufficient application volume has been achieved. As a cooperative agreement, this award involves significant scale and elevated federal oversight. We've covered the travel for the in-person meetings in years 2 and 4. This is new, slightly worded in a new way. SAMHSA mandates strict key personnel thresholds that may reduce your staffing flexibility somewhat, in so much that your project director and your evaluator must each dedicate 50% minimum FTE or level of effort to the project. These roles must be filled by 2 different individuals. Competitiveness for this funding requires that you prove, or any organization prove, that you can implement all 7 elements of the Zero Suicide Framework. If you propose working with partner organizations, letters of commitment detailing specific contributions are required. There is no room for SAMHSA. They have explicitly stated general letters of support will not be considered. Additionally, you have a project timeline submitted as attachment 4 that is now an explicitly scored component of the merit review. So this makes your 5-year sequencing a competitive factor rather than a compliance checklist item. This chart illustrates the scoring emphasis. 30% of your total is weighted on Section B, the implementation approach, followed closely behind by Section C, focusing on evidence-based practices and treatments, carrying 25% of your total value, and then Section E, data collection and performance measurement at 20%. That's 75% of your total weight right there. The need assessment is coming in at only 10 points. We interpret this to mean that reviewers will heavily favor execution design, fidelity monitoring, and data maturity over simply describing a local suicide burden. Post-award execution expectations are somewhat aggressive when you consider that you will need to establish an oversight steering council early, complete a zero suicide organizational self-study within the first 4 months in order to inform your implementation planning, And then on the clinical side, your screening and transition workflows will need to be highly operational. SAMHSA requires post-discharge phone outreach within 24 to 48 hours and follow-up care within 1 week of discharge for high-risk adults. Organizations that do not have reliable referral closeout workflows are going to feel the weight of the immediate operational strain. Ultimately, this competition for funds is really about readiness sensitivity. The most competitive applicants are not pitching a concept, not at all. They are demonstrating implementation readiness. They are showing strong leadership buy in, clear ownership of clinical workflows, operational capacity through alignment with named evidence based treatments, and robust data reporting infrastructure. The funding opportunity favors health systems. There we come back to that keyword, that are truly ready to go at day one to adopt zero suicide as an organization wide operating model under this active federal oversight. No matter how you come to this decision, consider a readiness or an alignment assessment for yourself, high fit evaluation, and then a response strategy support that really allows you to track, measure, and ultimately prove your outcomes against your stated goals. We consider it a privilege to be able to share what we understand about access and excellence with you. It is critically important to all of us that your organizations, you doing the work that you're doing on behalf of the populations you're doing it for, continue to survive. If at any point you need help on the way, consider reaching out online. We can schedule a vetting call. You can find us at www.HiQuitySolutions.com. That's HiQuity solutions.com. Till then, take care.